This is the CBS Evening News with Norah O'Donnell.
Thank you. We want to turn now to the very important issue of protecting our mental health. More than 6,000 mental health professionals in New York State are now providing free services to cope with the stress of COVID-19. Dr. Lucy McBride is an internist here in Washington. Her practice is based on the concept that mental health and physical health are connected. So, Dr. McBride, let's talk about that. How does our mental health affect our physical health?
Nora, I'm so glad you're drawing attention to this very important issue. As you know, we're dealing with an enormous crisis of physical health with coronavirus, but I also think of this as a crisis of mental health. So it's equally important to treat people's coughs, colds, and their symptoms of coronavirus as it is to treat the associated fear that I think we all feel at some point.
And on that note, what are you telling your patients?
Well, there are things you can do. I mean, the good news is you can help yourself with your own anxiety. First of all, if you're anxious, that makes you normal. It is normal to be anxious. We are wired as human beings for survival. And so our natural stress hormones are activated when we are faced with a threat. And this is a big threat. This is big. My job, as I see it as a doctor, is to replace fear with facts and to preach that gospel to whoever wants to listen.
What are some of the quick remedies if you're feeling extremely anxious or stressed?
One of the quick, easy things is to take enormously deep breaths. The second thing I'm asking people to do is download a free meditation app on your phone if you have a phone. Meditating helps bring us back to the present moment and helps us calm those stress hormones. The third thing is trying to get into nature, and it's safe to be in nature as long as you're distanced from other people. And then the other thing is just movement. Movement helps discharge adrenaline, helps quiet our minds.
I want to also ask you about stress and substance abuse. What about people who are dealing with addiction?
Many of my patients who are dealing with addiction are finding it harder than ever to stay sober or to be sober. So I'm telling those patients, this is not forever. This is not a permanent state of the world. But I'm also reminding them to not smoke, to minimize alcohol, and to quit if someone has an addiction.
Everything you have said will be so incredibly helpful. Dr. McBride, thank you so much for joining us.
Nora, it was great to be with you.
And since we are all in this together, we've put some resources on our website about how to handle anxiety and stress during the coronavirus outbreak. Go to cbsnews.com/COVID-19.